All right. Well, hi, hello, and welcome to Aligning Data for More Efficient, Effective Care. Now, today's exciting webinar is sponsored by Wolters Kluwer and produced by SmartBrief. My name is Jess Steinbach with SmartBrief by Future B2B, and I'm so happy that I get to be your moderator today. Now, our healthcare system, like just about everything these days, is evolving rapidly. Providers absolutely require the correct information at the point of care in order to outline the best treatment plans for their patients. Payers rely on drug and medical evidence so that benefits and treatment strategies can stay current. Very important, right? We know that both of these groups want to support healthcare consumers and improve outcomes for all of us. But keeping up to date on information that changes consistently in a world that is also moving very quickly. I mean, this is a very big challenge. Luckily, we have some help because today we will be joined by a group of top experts who are here to help us understand the current challenges, the opportunities, some of those best practices, and key action steps to developing active partnerships across your provider networks and member base. As you can tell, we have quite a conversation in front of us. I cannot wait to dive in. So I'm going to start out with just a few housekeeping points that are going to help you get the most out of our time here together today. That's me. I'm your moderator. I'm Jess. That's we don't need that. I'm over here. Let's move things along in our slides here. But before we get into the topic of conversation ahead of us, because boy, it's a really good one, I want to take a little bit of a guided tour of your audience console. And this is going to help you get the most out of our conversation because we want to be interacting with you as we go through our day. So let's start with your console in front of you. And I'm going to point out two important tabs. One is the handouts tab and one is the questions tab. I want to start you out in the questions tab because as we go through our day today, we want to hear from you. We want you to get interactive. Hey, Jintaras. Hey, Richard. Ooh, I saw Gilbert in here and Steven. What's up, Ed? Nice to see you, Corey, Wisconsin crew. I love that. We got a couple of Midwesterners here today. Hey, Vrej. All right, so keep those highs and hellos coming. We want to hear from you as we go through our day today. And our speakers absolutely want to hear all of your questions, your comments, your feedback, and your ideas. So make sure that you are jumping in the conversation as we go through. Use that questions window. Now, that questions window is also a great place to reach out to the SmartBrief crew if you are having any troubles with your system. Now, hopefully, knock on wood, no tech issues today. That's always the goal. But we all know that those gremlins can get in the system sometimes. So here's what you're going to do. If the gremlins are really getting at you today, somebody definitely fed them after midnight. I know it happens from time to time. I don't know who's doing that. The first thing you're going to do is a browser refresh. I promise that will clear most of them out. So browser refresh, that's step one. If the browser refresh doesn't work for you, then you're going to shoot us a message right there in that questions window, and our team will be there to help you out. Okay, so that was the questions window. We covered that. Let's jump over to the handouts tab. In the handouts tab, you have some great resources and takeaways, including a link to go check out the Wolters Kluwer site. Now, I highly, highly recommend that you spend some time there, but don't go too far down that rabbit hole just yet because we have a whole host of information coming your way. But open that tab now, save that for later, because I promise after we wrap, you are going to want to dig in a bit further. You're going to want to spend some more time exploring all of the cool content we have coming your way. So make sure you have visited that handouts tab. All right, well, the last thing I'm going to point out is that we do have a prize giveaway. We have a $250 Amazon gift card coming your way at the end of our webinar. Now, in order to win this prize, you do need to be here live and present at the webinar, and you do need to meet all of the SmartBrief prize terms and conditions. If you're not sure what those are, you can visit the handouts tab, click and scroll down, and you will find the full T's and C's waiting for you there. All right, well, that is it for the housekeeping. I think it's time that we get our incredible speakers on out here with us and get this conversation on the road because, boy, we have a lot to cover, right? I am very excited to introduce you all to our incredible expert panelists. Up first, Allison Combs, Head of Product, Payer Clinical Effectiveness at Wolters Kluwer Health. With over 25 years of experience in the healthcare industry, Allison joined Wolters Kluwer from Optum. Prior to Optum, Allison was at Blue Cross Shield of Michigan and Blue Care Network. Allison, welcome. Happy to have you here.
Thank you for me. Nice to see everyone. Thank you.
All right, and then Mitch, let's bring Mitch on down. I feel like a game show host right now. Mitch, Technical Product Management Associate Director at Wolters Kluwer Health. Mitch has nearly 25 years of experience in digital healthcare and care management solutions, specializing in virtual care solutions for health plans, health systems, and large employers' personalized experience. Mitch, welcome to the show.
Great, thanks so much. I appreciate you having me here.
I wish I had like more sound effects and flashing lights when I do that. All right, Penny, Penny Ransom, Chief Administrative Officer at Network Health. Penny leads Network Health's efforts in marketing, product development, communications, enrollment, claims, member services, and facilities. So Penny does it all. Penny has over 25 years of insurance industry experience. Prior to joining Network Health in 2010, Penny was the Director of Communications at Health Alliance Medical Plans in Urbana, Illinois. I was saying that without the right inflection. Urbana, Illinois. She earned her bachelor's degree from University of Illinois at Urbana-Champaign. Thank you so much for joining us, Allison, Mitch, and Penny.
Thank you. Great to be here.
Thank you.
Yeah, thank you.
Thank you.
All right, my friends. Well, let's get this rolling. And you know what, Allison, I think I'm going to put you in the hot seat to start us out here and kick us off on our wonderful conversation. Allison, could you give us a little bit of background? I think that's a good place to start about the current challenges related to payer-provider relationships, specifically as they pertain to benefit design and alignment to treatment strategies.
Yeah, no, thank you, Jess. It's a great question. I think both payers and providers really are looking for a timely answer, right, for the best possible treatment for a patient or a member if you're on the payer side. However, they're really coming at it from different angles, right? While they're both taking into account evidence, payers also have to take into account whether or not something is covered or appropriate from a population level, whereas providers really are looking at that individual patient level. So while the payers have to weigh also the financial costs as well as the clinical benefits, they're doing that up front, whereas a lot of the providers don't tend to look at the financial pieces until, closer to the end of that interaction that they're having with the patient. So, or even after the patient has left the health system. So while both sides are really trying to do what's right for the patient, it can often lead to different decisions. Especially when there's an influx of new evidence coming right into healthcare all the time, as well as the different timelines of when those decisions are being used, as well as, again, like I said, the evidence and the information, and as well as the systems, right? So what they're seeing at the time that they're making those decisions. So that's a super high level, but again, it's not a static situation, right? And they're all trying to work together more closely, especially as providers are taking on more risk and payers are, going more into the care delivery space. So it's still very nascent in our industry, but whenever there's change, there's lots of opportunity.
It's not static, and that's what I'm really excited to get into today. Is there's so much that's changing and evolving, and I appreciate that we're starting high level because we've got lots of time to dig in today. Penny, I'd love to bring you into the conversation and maybe hear a little bit about what you're seeing from the health plan perspective.
Yeah, I think just what happens is the lack of technology integration often between the provider and the payer can create a challenge too, because if we're not looking at the same information at the same time, it can delay things for the patient. So it really is important that we get on the same page and begin looking at things together and integrate as much as both the payer and the provider are comfortable with, and keeping in mind that if a provider is working with 6 or 7 different insurers or more, they may have 6 or 7 different systems that the payers want them to use, and that creates abrasion with the providers. So we need to find a way to tighten that up for everybody.
Whew, yeah, that's way too many systems. I'm thinking through in my head, just even internally when we just have different tools to use. But yeah, with the communication networks that you have to map through, I want to keep digging in with, and I realize we're starting on kind of a negative note, but I think it's important to really understand the challenges before we can move into some of these solutions. So Mitch, we're gonna keep the dark times rolling here. I want to ask you about the specific challenges around determining the medical and drug benefits, and maybe you can kick us off on that, Mitch.
Yeah, I mean, I think to add on to what you were saying, that it's very dynamic right now. There's a lot of new medications, new treatments coming out, and this is a very competitive landscape where a lot of employers are really challenging the payers to come up with innovative plans, different coverages. Members, people are seeing things on the news or reading about different options, and so I think there's a lot of pressure on the payers to compete in that landscape with with a lot of the demands from the employers.
Yeah, that's a great point. Allison, I think maybe I'd like to tag you into that as well. Allison, did we lose you? Oh, sorry, Allison. You know what? Your mic was muted. Let me unmute you. Allison, let's bring you into the conversation.
Am I live now? Okay.
All right.
No, that's okay. So, no, I totally agree with Mitch. I think it's one part of the equation. I think the other thing that's really starting to stress employers as well as payers out, and frankly, some of the providers as they take more risk on, are some of these emerging therapies, right? Some of these therapies have $1 million or more price tag. I think the most recent one was around $4 million estimated cost, right? And so, and these are new therapies, right? So the evidence around these therapies are new. And evolving, right? So as more people take the therapies, right, the evidence changes a little bit. So trying to stay on top of all of that, as well as kind of making sure the patient is responding well, right, and there's coverage for that patient, again, at a population level where it's appropriate for the payers, is very stressful, right? And then you have the government coming in as well with some new regulations around this space, and everyone needs to kind of adjust and plan for that. Adding into this mix, most of these therapies, not to make things complicated, many straddle the drug and the medical side, which has typically been more siloed in the past, right? And so really, in order to do right by the patient, you have to get these silos, these systems, these processes and the evidence, right? Especially between the payers and the PBMs, as well as the providers and the patients, right? To be talking together, right? And keeping an eye on what's coming so that everyone can understand what the opportunities are, as well as what some of the challenges, particularly with respect to comparative effectiveness. That is a new conversation, I think, that's starting to bubble up more and more in the payer space. But again, it's new, trying to balance between both the medical and the pharmacy side. And so that comparative effectiveness conversation is going to be really interesting to see how that evolves over time.
Constant evolution coming up again and again, and communication and breaking down silos. I'm excited to kind of unpack each one of these themes as we go. And Penny, I'm going to ask you to switch us. I know I said we were going to start with the negative, but I'm ready for positive now. So I'm going to ask you to weigh in a little bit on maybe some of the challenges that you would want to outline as well. But then, do you have any ideas on how we can start to address some of those challenges?
Sure. I would say one of the things that, kind of building upon what Allison was saying, is it's a person could have, I might have network health insurance and my neighbor might have it too, and I get that great new drug but my neighbor's plan doesn't cover it, and so it creates kind of the have and the have-nots as we move into Medicare covers certain things, fully insured plans typically don't cover things. And then a self-insured employer has a lot more freedom to do what they would like to do. So the different perspectives can really create some dissatisfaction for people. And really how we solve that, Allison, is what we were talking about before. Everybody getting on the same page, looking at the same information, having conversations, communication, both via technology and person to person, is really important in making this evolution and making the healthcare system less complicated for our members and our providers' patients.
All right.
Oh, totally agree with you.
Oh, yeah, go ahead, Allison.
Sorry, jump in there.
Yeah,
no, I think a great example of what Penny is talking about is the GLP-1s, right? We as an industry don't agree on what they are, whether they're a specialty drug or not. And so that, again, when you start taking into account not only the provider perspective, but payer perspective, there's a lot of confusion, right? And so I think it's really important that while providers and patients may consider that drug essential, again, going to that emerging therapy over time, the jury's still out on some of the complications of the GLP-1. So to what Penny is talking about, I mean, it's a little understandable, especially as these things cost a lot of money, why there's some hesitation on covering, some of these therapies, right? And making sure, again, that there's no adverse side effects, right, that are inappropriate, that might cause harm to them. So again, just about community community. I mean, it's not only from a human perspective to make sure as business professionals we're all aligned.
You know, Allison, two things. One, I think that was a great answer. Two, I am just getting a little glitch in your microphone, and I'm losing every other word that I'm hearing from
Oh,
you,
no.
which all of your words are
Uh-oh.
important. So I'm wondering if I could get you to just do a browser refresh, and I'll just put you right back in as soon as you come back, and then
Sure. Thank you.
get right out. Yeah.
Okay. Thank you.
Mitch, while we're doing that, I'm gonna shake things up here. And so where we were kind of going with this, and I think where Allison was taking us through to, were sort of the effects of misalignment on especially some of these newer and specialty drugs. And so wondering, A, if there's anything that you want to sort of chime in on that while Allison reboots, but then also, you know, kind of taking that a little bit more towards care management and how misalignment between clinical evidence and care management might impact members.
Yeah, absolutely. I think, you know, as Penny was talking about and Allison talked about, I think that transparency and consistency for the members is really, really important. So I think as, you know, the members getting, you know, the same information from, you know, kind of throughout that process is really important for their care, their overall satisfaction. And, you know, I think as you get into care management programs, you know, for example, if I was in a diabetes program or, you know, a weight loss program or other areas where, you know, maybe the program was recommending certain treatments or therapies that weren't covered or different, that could be really confusing for the members. So I think as they're, you know, in these programs, making sure that, you know, that information is just kind of consistent all the way through. So the member is able to kind of work on their own care, but also, you know, is aligned with the things they're being told from, you know, from the payer and the provider.
Yes. Okay. And Allison, you have perfect timing because so where we transitioned to was we were talking a little bit about where the misalignment with care management between clinical evidence and care management, how that might impact the member. And I think where we sort of left with you was that misalignment on newer and specialty drugs. We've got you back, microphone hopefully strong and clear. Can you give us a little bit more about that newer specialty drugs misalignment?
Yes, and hopefully my audio is better now. Is that correct?
Fantastic.
Okay. All right. Sorry, I got kicked out and I had to come back in. So I apologize to everyone. Thank you.
It's a live event, right? Live theater. You gotta.
Exactly. So we'll just swing with it. But I think where Mitch was going and very much aligned with that. You know, everyone wants the right drug or the right therapy at the right time or the right dose, you know, for the right person. I don't think there's an argument on that. Where the challenge comes in at kind of, you know, and I think all three of us have kind of touched on this. You know, people are using different systems, right? They're using different decision trees. They're using different coding, and sometimes they're often using different evidence or interpretations of that evidence in order to figure out what their decisions are. And that matters depending on which side of kind of the healthcare equation you're on, right? And this can cause a lot of inefficiencies as well as potential wasted treatments, right? You know, when in the world where you have drug shortages and other things, right, you don't want to be wasting our precious resources, right? And so in addition to causing abrasion between different parties, depending on what the nature of the issue is. So I do think it's really important to make sure that we, again, do our level best to communicate and align with the evidence first and foremost, and then figure out the logistics and all the timing and integrate our systems in an appropriate way. Did my audio hold that time?
That was loud and clear. This was
okay,
perfect.
All right. Thank you.
A+ answer, A+ audio. I love it. And we're gonna keep exploring the sort of problems and issues that this can cause for members. And I want to get into and make sure that we discuss this point of sort of what's being left on the table. But let's start out, and Penny, I'm going to actually bring you into the conversation here on the problems that we're seeing this create for members and kind of outlining that for the audience as well.
Sure. I think Allison really touched on it. Everybody wants the right care at the right time in the right place. And when that doesn't happen, or when it doesn't happen fast enough, the person who's hurt is the patient, right? And we hear every day our healthcare system is complicated. And when we're not doing things to ease it and make it better for the person, we're really doing a disservice. And, you know, there are downstream effects too, not just with the patient, but also with providers may become disillusioned with the health plan. We're seeing many say, oh, we're not going to take, they'll drop certain plans. And it also, members not getting their care affects the plans with their HEDIS ratings and their star ratings. And, there are lots of quality effects. And if you're in any government programs, for the most part, you're going to you could miss out on quality bonuses as well if your members aren't getting the care that they need. So there are many downstream effects, and that those quality bonuses are used to make better benefits for the member. So again, it always goes back to the member, where they're losing out when we don't do our jobs as well as we should.
That's so interesting. We really start if our core, our true north is the member experience, and then kind of building against that, then we can hit all the goals as an organization as well. Mitch, I'm going to ask you to weigh in on that as well.
Yeah, absolutely. As Penny said, the member satisfaction and impacts those scores and just that overall experience. And I think for the member, they're also again, looking for some guidance on what questions to ask or other things like that. So, I think as they're downstream in this process, if things are inconsistent or delayed, they may not be aware of what's causing that. And I think as the more consistent information and kind of helping the member to make decisions, I think is ultimately going to improve their experience and their overall satisfaction.
Allison, you sort of set a tone for us on this one, and what we're discussing here are sort of values left on the table. What is the opportunity cost of not making these changes that we're going to get into today? I think you sort of gave us a pretty good level set at the start, but I'm wondering if there's anything that you'd like to add or kind of expand on when we think about that.
Yeah, I think in particular with those goals and metrics that Penny was talking about, right? These are material impacts to not only the individual, but to the organizations, right? And so really making sure that we're doing the due diligence and walking the end-to-end journey of the multiple stakeholders to make sure that we're truly addressing it. I'm a firm believer in innovation, both sustainable innovation as well as disruptive innovation. And a lot of what we're talking about is both sides of the coin, right? And so with these new therapies in particular, you have to figure out how to do better with what you have. And you also have to build new, right, in order to support these new therapies in particular. But I think if you don't do that, right, not only do you have abrasion, right, and you may have some unfortunate health consequences to the member, but there's some real business value that's being left on the table. And back to those employers that Mitch talked about, they will vote, right, with their and so everyone in due course will tell you exactly what they think of how each entity is doing, depending on how that goes. So.
Yeah, people are not quiet about that. Can you repeat those styles of innovation that you like again, Allison? I liked those.
Oh, sustainable and disruptive. So disruptive, for instance, is when you create a new product, right? And you completely take away market share. Sustainable tends to be what you do with more mature market. Healthcare, there's a lot of maturity in the market. So, whether it's evidence-based content and solutions or whether it's health insurance services, you have to keep your, what you do fresh, right? And so in order to be sustainable, right, in the market, you have to continuously innovate and bring new ways of doing things, again, ideally without, causing undue harm to anyone in the process.
All right, so we're in this sort of the misalignment, the challenges mode. We're going to move a little bit into our best practices for creating that alignment. But before I do, I just want to check and see, Mitch and Penny, if there was anything else. Mitch, do you have anything you want to add on to our sort of value being left on the table, the opportunity cost of not disrupting and innovating?
Yeah, I mean, I think that consistency, I mean, this ties a little bit, I think, into the next slide as well, is just around, if there's a lot of information that's available just, online and in the media and on the news, and members are getting a lot of different sources. And I think trying to provide information that's contextual. So if I'm going in for an annual visit or a screening and getting the information at the time I'm looking to make a decision that's consistent with all the other things I'm hearing is just so important. I think that, it helps to, the members to make decisions and make decisions on their care.
Yeah, consistency really builds trust, right? If you're seeing the same things and across all different communication, you're slowly building up that trust. Penny, anything else you'd want to add?
I want to go back to something else and said she made a brief mention of employers. And I think one of the efficiencies, especially with self-insured employers, where many of them are very sophisticated and they have all of that information too, and they're big into data gathering. And we've talked a lot about the plan and the providers communicating well, but when we bring in a self-insured employer, especially one of the larger size, we need to bring them to the table too. And everybody needs to revolve around that member experience, like we talked about earlier, putting them at the center. But those members are valuable resources to the employer. They're important to us as the plan, and they're certainly important to their care providers. So I think that's a real opportunity going forward for efficiencies and improvements in our system.
Well, Penny, that's a great answer. And my reward to you is another question. I want to get into getting aligned. Let's get ourselves aligned. So how can health plans better align decision-making with their provider partners? What do you think, Penny?
Well, I can say what we do. We are a provider-owned health plan, but we also have 8 other clinically integrated health system partners, and we work with each of them individually to talk about their opportunities. We do a closed-loop primary care physician attribution model, so they know who their patients are and what their opportunities for closing gaps in care are, and really building the trust in the data we're giving them, the data we're receiving back. So that's been we've been working on this since 2017, and we've seen a really great progression of improvement. And also, I think something really great we've done is involving them in our benefit design process, especially in our Medicare Advantage plans, where they know what their patients are coming in and asking for. And if we can work together to make that work and make that available to their patients, it's a win-win for everyone.
Well, everybody's looking for that win-win solution. Let's win-win it up with Allison and Mitch. Allison and Mitch, I'm gonna tag you both in simultaneously. Allison, maybe you can start us out, and then Mitch can bring it on home. But what have you seen that's working?
Yeah, Penny said it a lot, so I'll just add something very briefly. Right, I do truly believe, because there's so many different stakeholders involved that are looking at different aspects, right? If everyone starts with the evidence-based medicine, right, and start there and align there, I think that trust and that communication and that transparency really goes a long way, right, in order to bring the parties together. You're never going to 100% agree on everything. But again, if you can keep the member at the center with that evidence-based, perspective in mind, I do think it goes a long way to help facilitate the decision-making. Mitch, I don't know if you want to add anything else to that.
Yeah, I mean, I think having, helping the member also with which questions to ask. I think there's a lot of information that's available. Mm-hmm. And, I think as somebody is making a decision about their health, sometimes people are hit with a lot of different information sources and aren't sure, even what questions to ask. And I think that's one area I've seen in shared decision making is just helping, give the members some questions as they come in and talk with with their provider about that. I think that's also really helpful, is that you're not just immediately giving someone which path, but helping them be a participant in that decision making process.
Well, I think that's a perfect transition, because we're going to ask the right questions of the audience now. We're going to bring the audience into this conversation because we want to hear from all of you. And as we've talked about, it's collaborative conversations and really coming together to make sure that you're hitting different viewpoints. And so, what has been your experience for all of you out there? What steps have you already taken to improve that collaboration and decision making in your organization? Now, there's a couple answers up here. We've got using data data from clinical care to inform decisions, calling on insurance payers to open collaborative dialogue, establishing clear patient goals, that's a good one, and gap closure metrics, and none. We've done nothing, and that's okay. If none is your answer, be honest about it. That just means there's room to grow. There's room for us to discuss together today. But we're curious what you all say. In just a second, I'm going to show you all the results. But before we do that, while you kind of getting your answers in, Mitch and Penny, I think you might have an interesting perspective. You've seen plans, or let me back this up. I'd like to get into some examples. So let's talk about, as you've seen plans try as far as using data to improve collaboration, which is one of our answers here on the screen. What successes have you seen come out of that? And if you have any commentary on where it hasn't quite worked, maybe we can learn a little bit and leapfrog over their mistakes. So what has worked, what hasn't? Mitch, maybe you can kick us off on that.
To kind of tie into some of the decision making before, I think some of the things I've seen that have worked well are, as somebody is coming in for a visit, being proactive to provide some of those guides and questions to ask, ahead of the visit and providing resources for them. I think an example I saw was, for people, who are due for the colorectal cancer screening, really stressing the importance of early detection and getting those screenings. And then what are some of the different options around colonoscopies or home kits, and just really helping to provide people with a lot of information. So as they come into that appointment, they have questions, they kind of know a little bit more about kind of what the urgency of getting that testing, and really can have those positive conversations.
That's a great place to start. Penny, anything that you've sort of seen succeed or not on that end?
Yeah, I think one of the things I guess if I were going to answer the poll question, I wish that D was all of the above. We're working to do all of those things. And one of the ways we use that data is offer our clinically integrated providers that I mentioned earlier the opportunity each year to apply for basically a grant from us to use to develop programs to help close gaps in care that might be specific to their system, or it's something they want to concentrate on in their system. And so that works for us because it's something they're excited about doing. And it helps us with our quality scores. It helps them with their quality scores. As Allison mentioned earlier, as they're taking on more risk, that's important. So it really kind of the rising tide floats all boats. And ultimately, as I'm a broken record, the member benefits in the end.
That's a good broken record to be there. I have just switched the results over. I should have done more fanfare. I should have drum rolled for that a little more. But ta-da! Here's your results. So what we're seeing is that vast majority, well, not vast majority, a majority are saying none. And kudos to you for acknowledging that. But then we also are kind of the next kind of largest group down is using data from clinical care to inform decisions. I'd love to hear from the group here. And maybe Allison, if you can kick us off. Is this sort of what you would have expected to see? Is this surprising at all?
Actually, to be honest with you, it's a little surprising. And I'm wondering if the none was kind of a catch-all for folks. But that's just a guess. But I think it's wonderful that people are using clinical care to help inform their decisions. For the folks that chose none, I'm wondering if there's other challenges and barriers that are getting into the way that we've either mentioned already on this call, or if there's other ones. So I would, I don't know if folks want to contribute or add to the chat or save it up for the Q&A at the end, but would love to a little bit more on that none in particular. That would be great.
Yeah, write it into the questions window. If you're an other, if you're a none or another, write it in. We want to hear from you, where you've piqued the curiosity of our speakers. So take advantage, reach out, let us know. Mitch, are you surprised by this? Any commentary?
Yeah, I think similar to Allison, I'd be curious, like, what were some of the barriers with that? I know, I know some of the challenges. Is it describing maybe that scenario with the clinical visitors, kind of tying the actionable materials at the time that member may be making some decisions? It can be challenging with delays in data. So that's something that I think looking for ways that you can partner with your providers to incorporate maybe some of those materials at that point in time when somebody's making a decision, and that does require some systems work and things there. But I think for the member, it's always beneficial to get the information at the time that it's that they're thinking about it, and it's really helpful at the time they're making decisions.
Yeah, that timely and consistent data. All right, Penny, I'm just curious because you sort of gave a prediction here and also said, and I think this is important, next time we need a all of the above option. Are you surprised to have seen the opposite of the all of the above, the none option kind of rising to the top there?
I am kind of, but I guess I would look at that as it's an opportunity. You can get some quick wins. Pick one.
That's the best. Penny, yes, good positive realignment. You've got only up to go from here. You've got only more alignment ahead of you. Just pick one and jump in. Well, fantastic. And for those of you who answered that poll, thank you very much. We actually have a second poll coming up. So if you didn't answer and now you're wishing you did because you wish you had participated in this conversation, there's still another chance. So make sure that you join in on the next one. But for now, we're going to keep going because I want to kind of zoom in our lens just a little bit on payers. I'm curious, and Allison, I think if it's all right, I'll hand the mic to you on this one. How is improving clinical evidence, reference, and alignment from benefit design to care management to drug benefits? This is a big question I'm throwing at you, I apologize. Expected to better position payers as invaluable partners in the healthcare landscape. So basically, how is this making everything better?
That is a very big question, actually. Okay, so let me take a stab at it. I think, again, we've talked about a lot of this already so far, but I think specifically with respect to partnerships, again, not to be a broken record, but to really align on the clinical evidence, regardless of what entity you're at, right? But particularly for payers, having something to stand on, and they already naturally do this anyway, but having those informed, consistent decisions that on their healthcare coverage that should align with the evidence that the providers are using at the individual level, right? Should help really align and the discussions and kind of the activities that are happening with respect to the members or on behalf of the members, right? And so I think continuing that journey will help the members only have a better health journey experience, but ideally better outcomes as well, right? And so, in other words, it's not just gap closures. It's not just, and while that's really important, and all of us need nudges once in a while to do the right thing, right? Going beyond that, really, and really trying to be more efficient and not losing the human in the process is really critical to helping those care experiences and the choices that everyone, especially the member, is choosing along the way, right? Or considering along the way, will not only help create more cost-effective care, but I really do believe that it will create better satisfaction for all parties involved, so they can focus more on what's the most important, which is the health of that person or the population, right? And not so much on the haggling back and forth on the money.
Well, I made that such a big question. I feel like it's only fair that we make everybody attempt to answer. Allison got us off to a great start. Mitch, can I ask you to chime in?
Yeah, I think, back with the theme of consistency, I think for the member, having information, people are getting a lot of information from, you've got information online and social media and friends and family members and in the news. And I think being concise and clear about and consistent with the information that they're getting, from the provider and the payer and what information throughout is just really, really helpful for people to make those decisions and, again, have a better experience.
Perfect. You guys are really doing a great job of kind of breaking this down because there's a lot of big ideas happening here. And I think you're giving us some sort of actionable steps and approaches. Penny, I would love to get your feedback as well.
Yeah, I think I'd like to tell a quick story. And it was a member called one of our pharmacists we have on staff because her prescription for her inhaler was denied because it was too soon. And when the pharmacist looked into it, she said, well, you're asking for a new one so frequently, what's going on? And she said, well, I can't get into the specialist I'm going to the emergency room all the time and I can't get into a specialist for 5 months. Picking up the phone, the pharmacist called our owner, because that's a benefit we have, that our owner is our premier provider, and saying, hey, this is going on, what's going on, and got the member in within a couple of weeks. Now she's back on track. And that's what this is supposed to be about. And even, we have big technology, but it is one person at a time we're caring for. And that's what we need to make sure we continue to remember.
You know what I love about that answer, Penny, and that really wonderful story is it kind of hits on two parts. I think all of us and everyone here would love to just really focus in on the human side of it and the human care side of it. And you're exactly right. That is why we're here. And that is we've said that a few times, that is that sort of compass point that we're always thinking about. But also, I think that highlights the fact that there's a monetary value to that. There's a resource value to that for the organization, that there's less efficiency helps as well, that you get the care, and that's less kind of going around and around for the providers as well. And I think that's important to remember, that there's financial reasons backing the human goodwill of it all. That those two are not mutually exclusive; they go hand in hand.
For sure.
Yeah.
All right. Well, let's keep rolling in with member experience, and Penny, I think I'll ask you to weigh in on this as well. Because I feel like we're moving into the positive side. We always have to start with the challenges. We got to start with the negative. We got to outline all the problems. And now we can just keep rolling with all the positive side effects. And that's the best part. So Penny, what are you seeing as some of these positive effects on the member experience and outcomes that are realized because of all the things we discussed earlier when setting that better decision-making alignment?
Sure. So I mentioned earlier that we started our clinical integration program in 2017, and we've been building it since then. And we have seen a progression not only in our star ratings in Medicare. We've been a 5-star plan for the last 3 years and are anxiously awaiting any minute now this year's results. Fingers crossed. But I want to narrow in on a big part of those Medicare star ratings is the CAP survey and the member satisfaction. That this year we had our highest CAP scores in the history of our plan, and we achieved 5 stars on 7 out of the 8 CAPS measures for the star rating. And so that's what we've seen. So, I can tell you a great story about a person, but in population health and in member satisfaction, we have that data too.
That's a great, and fingers crossed. I'm adding my good vibes. All right. Well, Mitch and Allison, how about you? Maybe Mitch, we can ask you to kick us off, and Allison, you can add on.
Mm-hmm.
Yeah. I mean, I think, just as we were talking about employers, I think that, that member satisfaction also translate up into their employers. If people are happy with their experience, that's going to be, aggregated across the employers, and those employers are going to be happier with those plans. So that's definitely, very key for, as the payers look to continue to, with the business with the large employers.
I wholeheartedly agree with what Mitch said. And then just to tie back to something Penny said, you can't get those star ratings or those CAP scores if you aren't reworking on your mechanisms underneath, right? To make sure it's as, almost invisible to the members so that they can stay more focused on their health, right? And their conversations in partnership with the providers and the resources that the payers are providing them, right? And so congrats on those scores and those results. It's fantastic. But again, this is what it's about, right? Really giving payers that opportunity to have more of that impact and opportunity with their members in partnership with their providers. So Penny's got a unique situation there. So they're much more tightly aligned. Not every payer has that opportunity. So kudos to you all.
Thank you.
Well, speaking of that 5-star partner, let's dig into what that means a little bit. So Allison, I'm going to keep things with you. What are the features that are most important if anyone in the audience out there is looking for that partner?
Well, in addition to the theme of keeping the human at the center, I think there's first and foremost 3 main things in any partnership relationship. And that's a mouthful, partnership relationship. But I think rigor, right? Everyone has to bring something to the table, and they have to be really, really good at it, right? And they also need to be transparent, right? Obviously, we're all in what we do to have some sort of impact, whether that's financial or from a nonprofit, kind of making the world a better place. And I'm not trying to be trite, right? We're all trying to drive and make the world a better place in some way or another. But I think if you're not transparent to an extent of what you're trying to do and why you're trying to do it, even while protecting the IP and all that stuff, I think it doesn't enable that trust that we keep bringing up on this call as well. And then lastly, you can't get to not only trust, but you can't get to alignment, right? So you can't get to that aligned decision making, right? And you can't, you really can't move forward, and the partnership will eventually dissolve. At worst, or at best, and at worst, the partnership could actually cause some damage, right? Mm-hmm. And so I think, really knowing what you're getting into, especially from that partnership or partner, in terms of what clinical evidence that they're using, how they're using it, what are the interpretations, how are they codifying it, right? Is it created by experts or is it created by not experts? I know our industry has had some of those experiences, so I don't want to belabor that point, but, really being able to validate the evidence, making sure it's consistent and it's kept current in a timely way, and it's leveraged equally across the system. To me, those are the pieces of the rigor, transparency, and alignment that would be critical in order to have an effective partnership. So I know that was a lot, but hopefully that helps.
That's rigor, transparency, alignment. Those are really great kind of keywords for folks to have in mind. And Penny, I think maybe I'll hand things over to you to see what Network Health has looked for in a partner. And specifically, you've had some great stories for us today. If you have any stories or if you want to elaborate at all on how you have benefited from working with a trusted partner.
You bet. And I think everything Allison said, all of those are important. And also, I would add innovation to the list. And by that, I mean, everyone, we're inundated with partner proposals, right? And, come see what I'm offering, and everybody's got a great idea. But what we're looking for, not just in the innovation, is a partner who's willing for us to push them a little bit to extend what they're offering, so that what we would be doing with them is just a bit different than what they're doing with everybody else, because we're in a business that is pretty commoditized. So if we can have a differentiator, and I'm working with someone right now who has changed is offering a whole different product because of one question that I asked. And, it created an opportunity for them to make them more marketable, but it gave me what I wanted for my business. So that's what we look for, is someone who is really willing to not just say, yep, here's what we have, take it or leave it.
I want to now, I promised the audience I was going to turn the microphone back around to all of them, and I think this is a great place to do it. So I'm going to ask all of you out there to weigh in and help us out with this conversation. Let us know what types of vendors that you've been working with to improve communication and collaboration between health plans and providers. And I'd also love, if anyone's feeling brave and communicative, chime in on the questions and let us know if if any of those kinds of what you've looked for in a partner really resonated with you, if you have anything you want to add to that list, that innovation list. If there's anything else that you would put in your key evaluation list when you're thinking about a partner, please do write that in and click on the poll now. We're going to chit chat about the results in just a second, but since we are getting close, this hour has just flown by. We're like 10 minutes out from the end of our time. How crazy is that? But as we get into our final minutes here together, Allison, I'm thinking I'd like to kind of switch and talk about some of the specifics with the UpToDate solution from Wolters Kluwer, and wondering actually if I could get you to give us a little bit of information on how health plans and payers can leverage this type of solution to improve communication and decision making.
Wolters Kluwer, we provide expert solutions, right, for experts, right, including healthcare experts. And so Specifically, many of our solutions include drug and medical content, as well as clinical decision support tools for clinicians, as well as the healthcare-related business professionals. So, while we strive to enable best care everywhere, and I loved Penny's answer about, just making it a little bit better, that innovation, that's sustainable innovation. That was a great example. So thank you. You still got to do it, and I'm sure she is, right, by increasing the consistency as well as the innovation factor, right, and the timeliness and the awareness. And I feel like a broken record, but it's really the application of all that, right, into the current best practices of both the clinical side and the business side, as well as infusing the medical and pharmacy knowledge into all of those processes and systems and infrastructure. That's really key in order to develop that.
Well, I think that's great. I'm going to take a quick pause. Mitch, I'm going to see if you have anything that you want to add here. But before I do, I'm going to show the audience their responses. Before I move over, now I'm Minnesota goodbying you all and adding lots into my next move. One more thing. I am curious. So we've got none but evaluating technology and or analytics firms. I'm going to show the results, and then I'm curious what all of you think about what we've sort of seen and heard from the audience here. So interestingly enough, we kind of have a tie between either none but evaluating and technology and or analytics firms. So before I ask you to weigh in on UpToDate, Mitch, do you have any thoughts on the results that we're seeing here from the audience? Oh, Mitch, do we have you muted? Yes, we do. Mitch, try again.
Oh, can you hear me?
Yeah, we gotcha.
Okay, great. Yeah, I'd be curious with, is for those that are evaluating, what are some of the things, what are some of the challenges that you're looking to have a vendor help with, and some of the solutions you're looking for? I think from particularly, I think kind of my background is a little bit more on sort of the member engagement side, so I'd be very curious as well as in some of the types of things that people are looking for in that area.
Nice to see that we've got a lot of people evaluating. Penny, any thoughts on kind of seeing either the none or none but I like that adds up to over half are either none but none and evaluating. That seems positive.
I agree with you, Jess. I think it's good to see. And I also liked Mitch's answer about member engagement, as it's probably obvious that's a passion of mine. So I love to see others and love talking about it too. So maybe we'll get a few questions about that.
Perfect. Allison, any thoughts from you on this?
Well, I guess I'll take the technology and analytics firms just to round this out. Both when I was at a payer and then in the companies that I've worked at since, analytics and technology partnerships were absolutely critical, both for sustainable innovation as well as disruptive innovation. And so I'm really happy to see that was a strong answer as well. And again, not to be another broken record, but innovation really comes from those overlap spaces, right? To tie us back to kind of those emerging therapies and crossing the medical and the pharmacy space. And again, I don't know who's on the webinar, but if you are bridging that space, I'm really curious to see how things are going and how you're creating that innovation and using the technology analytics to drive things faster, better, right, and more aligned, so that we can, while we can't always predict the future, we can certainly map our way towards it. And so, and that is really important in the healthcare space. Very few things turn on a dime, with all the systems and processes that we have in place. And so that mapping is really critical to help make sure it actually happens.
Boy, isn't that important? Yeah, everything's moving so quickly that sometimes I think it feels very easy to forget to take a breath and make a plan, to have a strategy. And instead you just sort of feel like you're running to keep up. Mitch, I was asking Allison before we switched into the poll, or as we switched into the poll, a little bit about the UpToDate solution and how health plans and payers are leveraging that in order to improve this communication decision making. Throughout our conversation today, Mitch, you have been really bringing things back around to member engagement, which I love, and wondering if we could ask you to kind of give us a little bit of information from that end as well.
Yeah, I think with as Allison talked about the we have up to date for clinicians and pharmacists, drug information. We have member engagement solutions as well that really are based on those same those clinical guidelines and the same foundation. So again, that consistency for the member of the things that they're hearing kind of throughout the process. So whether it's care managers being able to kind of send follow-up materials to their members, they're working on care plans, or more population health solutions of focusing on things like preventive screenings and other areas. We have different member-facing materials as well. So that's definitely a passion of mine, and something I think is really important to have kind of throughout that process with consistent information.
Well, I have sort of good news and bad news, because the bad news, I just have bad news. The bad news is that we have to end the conversation there. So that's just, there's no upside to that. I suppose the upside is we've had about an hour of really interesting conversation. We have all learned a ton. And here's where I'd like to sort of leave things as we head on out about our days here. I'd like to kind of finish off with a final thought from each of our incredible panelists. And you guys have each given us such different perspectives and insight as we've gone through today. So I think we'll kind of get some different angles on next steps and what you would want the audience to be thinking over, mulling over, or perhaps taking action on in their organizations. So maybe what I'll do is I'll ask Allison to go first, and then Mitch, and then Penny, you can be our grand finale. So final thoughts, key takeaways. Allison, what do you think?
So I've worked on the payer side, the PBM side, and now on the vendor side. I will tell you, a lot of people make assumptions about the other side. And I would just really encourage everyone to have that more, humble, transparent interaction and conversation to, everyone's trying to solve, most everyone, I should say, is trying to solve and make things better. And, but you can't really solve for it until you build that relationship and that trust. And so acknowledge the assumptions and then figure out how to kind of move past that so you can truly innovate and help everything do a little better. So that would be my final thought. Thanks.
That's our key takeaway. Everything just a little bit better. That's what we're going for. Mitch, what do you got for us?
You've been highlighting that theme of consistency. And again, I would just trust that point that people are hit with a lot of information from a lot of different sources. And I think it's really important to really help distill things down. And oftentimes people they just also need help just what questions to ask. And so I think that, in addition to information, helping people with the questions to be part of that decision-making process.
Perfect. All right, Penny, grand finale, final thought of the day.
It's funny. I've only known Mitch and Allison in preparation for this webinar, and they both said what I was going to say. So, I was going to say assume positive intent from the other sides, right? And what I will say is 8 years ago, almost to the day, a new CEO walked into our organization, and we had town halls to introduce her. She wasn't coming from a health plan. She was coming from a provider, and she was talking about all the things we're going to do. And mind you, at the time, we were starting a financial turnaround. But one of the things she proclaimed is that we would be 5 stars. Now, today, she'd tell you, when I said that, I didn't have a clue what it meant. But what I'm telling you today is it's possible. So do it.
That is a perfect wrap-up thought. It's possible, so do it. Also, I really appreciate that you guys are all hive-minding after this webinar. That's amazing. Like I said, I so wish we could keep going with this conversation. I feel like there's so many elements here that we could spend a webinar unpacking each one of them. But I want to thank all of you for coming and giving us such a wonderful conversation, discussion, and interactive walkthrough of some really, really important topics today. It has been an absolute pleasure chatting with all of you.
Same.
Thank you for having us.
Thank you.
All right. And to everyone who participated in the polls, thank you very much. Now, I know we had to cut our Q&A short. We had so much information to get to, so you can blame me. But if you want to get some questions in still, there's still time to do so. And for anyone that has asked a question that we did not get to in our live Q&A or non-existent live Q&A, because we we had so much to cover. Please do continue to get those questions in. We're going to make sure that all of those questions get sent over to the Wolters Kluwer team, so you will get responses back. So continue to get those in. You know, any general wonderings, now's the time. Get those questions in. The other thing that you can do to get more information right away is visit the handouts tab. Make sure you click on that link. Go explore, get to know Wolters Kluwer a little bit. We just scratching the surface, right? There's so much more to dig into and explore after this conversation. So make sure you click on that handout and kind of follow that link through to a little bit more learning, a little bit more curiosity and discovery on your end as well. All right, well, I am going to get through one last exciting piece of business here today, and that is our prize giveaway. It is time already. A $250 Amazon gift card going to someone who is here live and present at the webinar, and that special someone is Dawn Bina from Minnesota. Dawn, I almost did that with my Minnesotan accent. I'm going to do it. Dawn Bina from Minnesota. How was that, Dawn? Did I do okay? I'm from Wisconsin, so if I got that wrong, you can blame my Wisconsin roots. Minnesota there. Thanks, Dawn. As always, we will be in touch about claiming your prize after we wrap up the webinar, so stay tuned for that. All right, well, with that, on behalf of the Smart Brief team, I want to thank Wolters Kluwer for making this webinar possible, especially to our wonderful speakers, Allison, Mitch, and Penny. You've given us so much to think about today. I really love these styles of conversation where we get to kind of step out of the usual like presentation mode and just have more of a casual chit chat and hear about what's exciting to our industry leading experts. You know, what are they talking about and thinking about? And I think we really got a great picture today of what the focus is and really that member experience being, you know, over and over again coming up, member experience and consistency and communication kind of throughout our day today. So yeah, hopefully that kind of gives you a kickstart. We heard from a lot of you in the poll that you're in a little bit more of this research phase. You're learning and discovery kind of phases right now, and that's an exciting place to be. So the next step is, now you've attended this wonderful webinar, maybe you watch it again on demand when we send it out to you. You follow that handout and you keep that conversation going, because this is only the beginning of your discovery phase. So I want to thank all of you for joining us today. I hope that we'll get to see you all again soon, and until then, have an absolutely beautiful end to your day. Thanks all.